At T-Mobile, our critical mission is providing unparalleled 5G coverage for when connectivity is mission critical. Introducing T-Priority, America's best 5G network experience for first responders, even in times of congestion. More capacity, faster speeds, better coverage. T-Priority from T-Mobile, built for tomorrow's emergencies, ready today. Discover more at t-priority.com.
For qualifying organizations on eligible rate plans, coverage not available in some areas and may be impacted by emergencies.
Does it ever feel like you're a marketing professional just speaking into the void? Well, with LinkedIn ads, you can know you're reaching the right decision makers. You can even target buyers by job title, industry, company, seniority, skills. Wait, did I say job title yet? Get started today and see how you can avoid the void and reach the right buyers with LinkedIn ads. We'll even give you a $100 credit on your next campaign. Get started at linkedin.com/results. Terms and conditions apply.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hello, everyone. We have an exciting guest here today, one of my colleagues, I guess you could say, from dental school, Dr. Noah Brayton. So Noah, could you introduce yourself a little bit? Tell us about kind of your background, anything fun you want us to know, where you're at now.
Yeah, I'm Dr. Noah Brayton from Grand Rapids, Michigan originally. Obviously went to dental school with Haley at the University of Michigan, Go Blue. And then now I'm down in South Carolina at Fort Jackson. I'm in the Army doing an AEGD 1-year program. So I've got about 3-4 months left in the program. Time definitely flies since graduation. It's crazy to think, but yeah, happy to be here, happy to be on, happy to share some experiences and kind of talk a little bit about what I've been through and my path into dentistry, you could say. So
awesome. We're excited to have you, and I appreciate you coming on and being willing to kind of share your process. Before we get into all the fun things about Army dentistry, residency, all of that, I want to go back a little bit more in time and talk about your pathway getting into dental school. So what did you do in undergrad? What did you do with your dental application? How did all that go?
yeah, so I went to undergrad at Butler University down in Indianapolis. Had a great time there. It's a pretty small school. Studied chemistry. And I knew going into undergrad that I was interested in dentistry, but wasn't really like full blown, like, let's do this thing, like whatever. Had an experience where I was able to assist at a private practice up in Michigan, northern Michigan, and really got some good experience there. And that's when I was like, you know what, I want to do this. Like, I want to be a dentist. I want to practice the same kind of dentistry that the person I'm assisting does, all this kind of stuff. Got really into it at that point. But this was like junior year. And so I was kind of a little bit behind on getting some of the prereqs in. Obviously chemistry, like majoring in chemistry, you get a lot of those prereqs for dental school to begin with. But didn't have like any anatomy or physiology experience or anything like that. So after I graduated in 2018, that summer I started a master's program at the University of Michigan, and that was a master's in physiology. And through that program, I was able to get some more prerequisites, and then ended up applying at the end of that year to start in 2020. But I did take a gap year. You could say 2 gap years if you're not including the master's, but a year between finishing the master's and starting dental school in 2020. Took a year off, which was awesome. I would recommend a gap year to anybody that's contemplating it. At the time, I was like, shoot, I'm like falling behind in life and all this kind of stuff. And like, I'm going to be old, like when I'm in dental school, which really wasn't the case. I don't know if gap years are necessarily as common in dentistry as they would be for like medicine. I know a lot of my friends that went to medical school route, they've taken a gap year or 2 or 3 even. But I loved my experience in my gap year. Was able to work at a lab at Michigan, and met some really cool people. Was able to kind of save up some money too, which is great. But was definitely itching to get started in dental school. And once 2020 rolled around, I was ready to go.
So did you spend your master's program and the gap years living in Ann Arbor that whole time?
Yeah. Yep. I was in Ann Arbor that whole time. So I was able to kind of get the lay of the land, you could say, before starting dental school. which was nice. My wife, who was my girlfriend at the time, she was also with me there. So she was working at the Ross School of Business, and then she ended up starting a master's program at the School of Public Health when I started dental school. So those first 2 years of dental school were obviously crazy for both of us because she was doing a 2-year master's program and I was in the first 2 years of dental school, which we know it's a little gruesome at times. But yeah, we balanced it pretty well, and I have no regrets about the way things kind of went. Obviously, everybody has their own route to get to where they want to be, and so I think the biggest thing is like for me was just kind of staying patient, trusting the process, doing everything I could to get myself where I wanted to be, but not stressing out or freaking out about things too much because if you want it bad enough and if you're willing to kind of put the time in and put the effort in, you'll get to that spot.
So did you feel like, and I mean, just kind of general advice for people that are going into gap years or thinking about a gap year, you obviously said you did research during that year. You were still in Ann Arbor. Ann Arbor's, where the dental school is that we ended up going to.
Mm-hmm.
Did you kind of pick to be at Michigan for that master's and doing research all like in hopes that that's really where you wanted to go to dental school? Or is that just kind of where life led you?
Yes and no. Yeah, I wanted to go to Michigan. Growing up in the state of Michigan, it's pretty obvious, like the weight that the Block M carries, and the dentist that I grew up going to went to Michigan, and he was a great guy, or he is a great guy. But yeah, I'd always had that hope to go to Michigan. I'd be lying if I tell you I kind of didn't, or I guess my wife and I didn't like kind of strategically plan that out. And it worked out that way. For many others, it doesn't work out that way. Dental school is tough to get into. It's a lot tougher than what I originally had thought when I was an undergrad. But yeah, I mean, I think I applied to only like 6 schools, and had a couple options. And then the Michigan rolled around and I was like, yes, this is what I want to do. But during that time in my master's and in my gap year doing research, was definitely kind of in Patty Catcher's ear, who was the admissions director at Michigan, and was kind of just trying to make myself known so that I'm not a stranger by the time interviews come around and stuff like that. So yeah, so yes, in short answer would be yes. It was kind of strategic in that sense, and I'm glad it worked out the way it did. But I don't think I would have been upset if I went to another dental school per se. So.
Mm. So tell me more, when did the Army come into the picture? Was that during your gap year? Was that during dental school? How did you decide that that's what you wanted to pursue?
Yeah, the Army is it's one of the best things that's ever happened to me, to be honest with you. I love it. I love my time here so far. But yeah, so actually in undergrad, I joined the pre-dental club. I want to say it was my junior year. And one of the meetings we had a Air Force recruiter that was doing HPSP stuff, and he came and talked about the scholarship and all that kind of stuff. And I was like, oh, this is pretty interesting. I have family members that are in the service right now. I have a cousin that's in the Air Force and a cousin that's in the Navy, and I was like, yeah, this would be cool. Maybe I can kind of follow their footsteps in a different path. And then, whatever, it's kind of in the back of my mind. And then dental school applications come around, and I'm thinking like, maybe this is something that's kind of worth looking into. And maybe it would be a fun gig. So I talked to my wife about it because obviously she's a big factor in all of it and stuff. And she didn't even like hesitate. And she was like, yeah, let's do it. Let's have some fun. Let's see the country a little bit, maybe even see the world possibly. And for us, it's been a great opportunity to, live in a new state. We're in South Carolina right now, and we'll be moving again this summer, and who knows what's going to happen after that. But yeah, so I want to say it was like right before I got the notification that I got accepted to dental school. I was kind of finishing up my application for the Army as well. So that kind of happened at the same time. But yeah, no regrets about it. Things have been going really well so far.
So for people that don't have much background in knowing how the application and everything works, technically, can you not submit the HPSP application till you have an admittance to dental school? You were just kind of being prepared and getting all your ducks in a row?
Yeah, yeah. So you can't, I think part of the application was that you have to have like an acceptance letter in hand. So the second I got the email, or I mean, obviously you get a phone call first from a dental school saying you got accepted, and then we'll send you an email later today. Got the email, and I think right when I got the email, I forwarded it to my recruiter just so that we can get that application in, because that's like the last thing you kind of need for the HPSP scholarship. So yeah, that kind of happens. Like you like pretty much started the process of the application, and then it wasn't submitted until that acceptance was in hand. But it's definitely one of the things that you need in order to get the scholarship, because they're not going to pay for a school that you're not going to go to, if that makes sense.
Absolutely. And I mean, this probably feels like so long ago, thinking back to like my application process. I'm like, how did all like the logistics work? But a few more questions for people that are maybe pre-dental or considering it. So how did you decide Army versus Air Force and Navy? And then what if someone wanted to do Army HPSP but didn't get in? Is there time that they could then apply for one of the other programs, or do you kind of have to just make a decision?
Yeah, I was pretty dead set on Army. And for no other reason other than my cousin is in the Air Force and my other cousin's in the Navy, so I thought I'd round it out. My grandpa was also in the Army as well, so I guess you could say that there's a connection there. But I think the Air Force works a little differently timeline wise. I think they might have interviews. You might have to interview for that one. We didn't have to interview for ours. And I think the Navy is pretty similar to the Army's application process. But yeah, I pretty much was just like, I think the Army is cool. I don't know. Air Force and Navy, I have nothing bad to say about those two either. But for me, it was like, I just kind of want to round out what the family's got going on at the moment. So yeah, so that's kind of how I made my decision. But I can't really speak too much about the other branches, but I believe the application process is pretty similar. For anybody that's looking into those, I would just say reach out to a recruiter. It's usually like a medical recruiter, and they can kind of help you get squared away with those questions. And there's also a lot of stuff online. There's some forums that you could look up, or just even like the Go Army website has information about the HPSP scholarship as well, and kind of how that timeline looks for an application. But yeah, if I were to give advice for people like considering Navy or Army or Air Force, just possibly if you're wanting to live somewhere, consider like where the locations of the bases are. Navy's always going to be around the water for the most part, because that's what they do. And then Air Force and Army are going to be a little bit more inland. I knew Army had quite a bit of bases outside of the continental United States, which is pretty cool. So that was like, okay, maybe if I can go to Germany or Italy or something like that for a couple of years would be pretty sweet. So,
is there anything that you would say throughout dental school was a surprise or different as part of your Army process that you didn't really realize when you had signed up initially, or is everything pretty clearly laid out?
Oh gosh. Yeah. So I'm trying to think back. So in dental school, you're not really doing a lot with the Army, at least at our dental school. So the way it works is that you have to complete basic officer leadership course and direct commissioning course, which is, for me, it was 6 weeks that I did this past summer. So after graduation, and that's like training. That's, little dentist / medical officer boot camp kind of thing. That was down in Fort Sill, Oklahoma. And then we did another 3 weeks down in San Antonio at Fort Sam, Houston. If your dental school has a summer break, like between first and second year or second or third year, I think there's dental schools that do that. You could go to that training at that time. Obviously at Michigan, we didn't have a summer break, so I wasn't able to do that training until I graduated dental school. And then I went to that training and then went right from that training to South Carolina. So it's a pretty busy summer for me this past summer. But outside of that, there really wasn't much. They really want you to focus on school. They want you to focus on, learning dentistry. They want you to, be involved in your community and that kind of stuff. There is like 45 days a year of active duty time that you do. but your active duty time is at school. So you're not like reporting anywhere, it's pretty straightforward, but I wouldn't say there's any like big surprises during dental school per se. But once I graduated and kind of joined, things moved pretty fast. Like I said, it was graduate and then early June, fly out to Oklahoma, do 3 weeks there, and it's hot, and I'm from Michigan. I'm not used to 100-degree heat. And we're learning how to march and do all that kind of fun, cool Army guy stuff, which I had a blast doing it. And then you go down to Texas and you're there for another 3 weeks, and you spend a week in the field living in a tent, and you're shooting weapons and you're doing that kind of stuff, and you're kind of seeing what the Army is all about. And at times you kind of forget that you're a dentist. So it wasn't until I got out of there and got to South Carolina at Fort Jackson where I'm like, oh yeah, okay, I got to do all that dentistry stuff now that I had learned for the past 4 years, but I hadn't touched a handpiece since May. So it was kind of, I wouldn't say relearning, but it was kind of reteaching myself how to ride a bike in a way. But yeah, I wouldn't say it was like any big surprises though. Dental school I felt like they gave me the opportunity just to learn, focus on dentistry. And then now that I'm in my AEGD program, it's been the same thing where they just really want us to learn dentistry, be the best people that we could be. So.
Awesome. So before we talk about residency, I want to talk a little bit more about dental school for you. What was your experience like? Anything you want to share or highlight? Any advice for people to kind of make the most of dental school? Yeah, well, I'm a very positive person, and I'm going to say that straight up. So everything to me is like awesome. So like dental school, I had a blast. I loved a lot of the people that I met. I have some lifelong friends that I made in dental school, and I felt like dental school for me, I was able to balance school and like my own personal hobbies quite a bit. Like, as you know, I played hockey all throughout dental school and whatever, and was pretty involved in that kind of stuff. I went skiing all the time because Michigan has nice winters for that. And I didn't feel like I was behind in school at all. So that was great. I had a great school life balance, you could say. And I think, one thing that I keep hearing, especially throughout this residency, that I can kind of think back to dental school about is that dental school is kind of what you make it in a way. Obviously, there are things that are out of our control as students. There's times I remember where people were very frustrated with their patient selection and like patients canceling and stuff like that. And that's just the nature of what it is. And I think that's part of dentistry in general, is that, your patients are going to cancel on you and things aren't always going to go according to plan, and you got to be able to react. So in a way, it kind of taught me stuff about that. I loved our faculty members at Michigan. I got to give a shout out to Dr. Hill. He was one of my favorite people I've ever worked with. Great person. But yeah, I had a great time in dental school. Learned a lot from obviously the faculty and stuff, but also just learned a lot from my classmates. Those 2-hour lunch sessions when we'd just be sitting in the forum and talking about dentistry or talking about cases and stuff is where I feel like I really picked up a lot. Yeah, I had a great time. And for anybody that's about to start, or maybe they're kind of having doubts about things and they're in the process right now, or they're in school and things are not going according to plan or something like that, I would just say kind of stick it out, see if you can see the long game. It gets better once you get to D3 and D4 year, obviously, when you're seeing more patients and doing more hands-on dentistry and less book work. But I think there were times when you kind of question yourself, but I'm glad the way things happened. And I definitely think leaning on the support system of friends and classmates and stuff like that definitely helped. Yeah, that's all really good advice. And just like you said, attitude is kind of everything. Like if you're sucky and depressed all the time, then dental school is going to be depressing. Like you have to just try to go into it with a good attitude, even if situations are tough sometimes. For sure. So what was your residency application process like? How did that work with like ranking programs? Did you have like a formal application you completed? How did that go? Yes. So yes to all. There is a formal application for the AEGD program, the AEGD 1-year program. So the Army actually has an AEGD 2-year program as well that you get a degree for. You get a master's degree. So it's recognized as a specialty, but it's just as a comprehensive dentist. Pretty cool stuff. But I won't get too much into that because I'm not in that program. I'm in the 1-year program right now. But yes, the application process for that occurs towards the end
of it occurred at the end of last summer. So I'd say August of your D4 year is when I got an email from the Human Resources Command down at Fort Knox saying that it's time, to apply for the AEGD 1-year program. Everybody in the Army that's going into the Army or graduating dental school going into the Army has to apply for the 1-year program. And then whether you want to take that spot or not is up to you. And not everybody gets accepted to it. But if you do get accepted, you have the option to either say, yes, I want to do this, or no, I don't want to do this. And I just want to go in and do my 4 years or whatever and kind of be done. So yes, we had an application. I believe the application was like 3 letters of recommendation. It's pretty similar to like a standard application, but 3 letters of recommendation. We had like a personal statement. Obviously send in your transcripts, class rank, all that kind of stuff. And then with that, we ranked where we wanted to go. And so I believe we have 7 AEGD 1-year program locations in the Army. It's Fort Jackson has one. That's the one I'm at. Fort Campbell in Kentucky has one. Fort Sill in Oklahoma has one. And then there's many others that have some as well. I think 7 or 8. I can't remember exactly. But yes, I ranked, I don't think I even ranked Fort Jackson as my first choice. But looking back, I probably would have. If I would have known it had been this awesome. South Carolina is just a great state, so I'm a little biased. But I think I had Fort Carson out in Colorado, maybe as number 1, and Joint Base Lewis McChord out in Tacoma, Washington as number 2. Some pretty cool locations. And then I believe I had Fort Jackson number 3. And I think in the email when he said where we were going, I think he said that everybody got, or most people got their top 3 choices. So they do their best to try to match up, personal preferences with kind of how it looks from their end. They have, I believe, changed that system. I think the actual program directors now are able to kind of see each applicant. And then it's almost like a draft in a way where they'll like kind of see the applicants and they'll pick the applicants for their location. So I can't speak too much about, the selection process because I've only been on one side of it, but the application came out in August, and then I think we got word in early December that we had gotten accepted to the AEGD program, and then we heard back a couple of weeks later about where we were going. But I think this past year it might have been a little later. I think they didn't hear back where they were going until like January or February. So it's kind of always changing. But that's the general timeline from what I remember.
Nice. And for other types of residencies, people might like go visit the program, or they're going to at least like email and talk to residents or directors. Is that something that they kind of helped facilitate you getting connected with these programs, or did you just have to do your own reach outs and figure out how you were going to rank places?
Yeah, so I didn't really reach out to anybody, to be honest. The Army is very standardized in the way that they kind of approach these things. So, and ideally, I think everything is kind of standardized across the board among all residency locations. With that being said, you're going to have different experiences just from the sheer nature of you're going to have different mentors and people that you're working with. The prosthodontist that I work with is probably going to be a little different than the prosthodontist that's at Fort Carson, or the periodontist that I work with is probably going to be different than the periodontist that's at JBLM or Joint Base Lewis McChord. So that, that's going to be a little different. And I think your experiences may differ a little bit based off that. But, with the whole CODA accreditation and everything, they try to keep things as standardized as possible. I was kind of ranking mine based off location because that's pretty much the only information I could really get out of it. I'm happy to be, for anybody that's interested in kind of learning more about each location or whatever it may be, I'm happy to be a contact to answer those questions too. But yeah, I mean, it's kind of hard to get, at least I found it was kind of hard to get contact information, and I wasn't really like delving too much into it. I'm kind of one of those people that just goes with the flow, and when I show up, I'll figure out what I'm doing, kind of thing. I know you know that about me, but yeah, you could definitely reach out and figure out that kind of stuff. I never did. And it's also difficult at times because people move in the Army. So the mentors that I have this year might not be the same as what somebody will have next year at the same location, because I think our periodontist is getting moved to Fort Stewart, which is down in Georgia. And so, things just vary slightly from year to year. But yeah, that's pretty much all I can say about that. I luckily, everything worked out pretty well, but I'm kind of naive in that fact where I'm just like, send me wherever and I'll figure it out from there kind of thing. So.
Mm-hmm. So everyone's pretty much doing the 1-year residency unless for some reason they decline it. After that, if people are interested in further specializing, which specialties does Army offer?
Yeah, so they offer I think they offer most major specialties that you'd think about. So they have endodontics, oral surgery, periodontics. They do, I think, radiology, pathology. I'm probably missing prosthodontist. You can do the 2-year AEGD program, which I'm looking into at the moment. So they have a lot of different specialties. I don't think anybody's really kind of being like, oh, I wish they had this or I wish they had that. I think pretty much anything that you essentially could offer, they definitely have. In terms of the 1 year, I don't remember, because I don't remember what the data was for people that applied and the people that got accepted and the people that accepted their spots. I think we have enough for like 40 something people, but I think like 100 and something people applied to the AEGD, or maybe 80 something people. So it was around like maybe like anywhere from 60 to 70% acceptance rate into the AEGD program. And then from there, it was kind of up to people, for whatever the reasons was, to either accept or deny that spot. I know we had a couple classmates that are not doing the AEGD program, and they're just kind of practicing in their clinic at this moment in the Army. And I don't know what that looks like, to be honest, but yeah, there's a lot of different specialties. A lot of people will do the 1 year and just kind of feel things out. In dental school, I couldn't tell you what I would, if I wanted to specialize, what I would pick, and to this day, I don't think I could say like I like one specialty more than the other. But I have, classmates in my residency class, and I know people that are going through the residency and they're like, you know what, I really like pros, or I really have found a love for oral surgery. And so from there, then they then apply to those programs. So it's actually pretty common to see that after a 1 year program. I don't know how often people come out of dental school and start residency very fast. I know one of our classmates did in the Army, Jack Sherwood. He's just down the road here. He's like 45 minutes away, which is awesome. Been able to see him a couple times, but he starts his oral surgery program next year. And so the way that the Army does it, you have to apply essentially like 2 years before you would start. And they'll hold you in a snowbird, what's called the snowbird year, which I don't want to get into all that kind of crazy stuff because it gets confusing. But yeah, they offer all the residencies, and I would say a lot of people will apply those residencies after the 1 year program, because you do get a lot more exposure to different things that you just don't get in dental school, and you can kind of get an idea if you really like those things or not. So.
This episode is brought to you by Peacock. The new Peacock original documentary, Matthew Perry, A Hollywood Tragedy, dives deep into the beloved actor's rise to fame and his tragic death. 5 people, including Perry's personal assistant, 2 medical doctors, and an alleged Hollywood drug dealer known as the Ketamine Queen, were charged with conspiracy to illegally provide Perry with the ketamine. Explore the details of the case in this heartbreaking special, streaming now only on Peacock.
Hey, Fidelity. How can I remember to invest every month?
With the Fidelity app, you can choose a schedule and set up recurring investments in stocks and ETFs.
Oh, that sounds easier than I thought.
You got this.
Yeah, I do. Now, where did I put my keys?
You will find them where you left them.
Investing involves risk, including risk of loss. Fidelity Brokerage Services, LLC, member NYSE, SIPC.
Nice. I mean, we were talking before we started recording. It's just crazy how quickly time has gone since graduating. Like, it's almost the time when the class below us is about to graduate. So it really has been almost a year.
Yeah.
And you're saying a few more weeks, which is really just a couple months, you're going to be going to whatever is next for you.
But overall, like, how was the 1-year residency? What are some of your favorite things you've gotten to do? What are some things you're really interested in, I guess?
Yeah, I have become an absolute nerd with dentistry in this 1-year program. And I guess like I was in dental school a little bit, but I've just been so enamored with how much there is to know and how many cool things we're doing in dentistry right now. It's just so cool. I think it's a great time to be a dentist. I think it's a great time to be in the profession. It's a great time to learn about these kind of things. Um, but yeah, we've been able to do, anything from perio surgeries. We've done a decent amount of like crown lengthening and distal wedge, or a decent amount of GBR, extraction and ridge preservation and implants and that kind of stuff, which has been fun. So I think going into the program, I was most excited to do the implant stuff. Now that I'm doing it, I'm like, okay, this is cool, but I've really found a lot of interest in, I don't want to call it bread and butter dentistry, but I'm so enamored with CAD CAM and that kind of stuff. I think being able to streamline those processes is so awesome. Been able to do a decent amount of like molar endodontics and that kind of stuff. And we have really good mentors where we're at, Dr. Swiss, Dr. Gage, Dr. Gonzalez, and they just do such a good job at really making things easy to understand. And they're there for support and are always down to talk dentistry. And it's such a good opportunity for, a young dentist like me who just wants to learn everything and try to get to know as much as I possibly can. But I would say for me, like, my biggest interest has been kind of within our materials, the CAD CAM stuff, the digital dentistry stuff. I've like been obsessed with Mio staining and glazing lately, so that's been fun. It's been a fun topic to kind of discuss and kind of see how I can artistically do things. I enjoy, but on the flip side, I also enjoy doing surgeries and stuff like that. So kind of what I was talking about, like you kind of go into this program being like, okay, I want to learn this and this and this, and then I'm at this point now where it's like I kind of learned those things and I'm still just kind of like delving deeper into different things, but I don't think I could possibly say that I like one area of dentistry more than the other, which is why like AEGD is such a cool option. But yeah, it's been great so far. I'm still learning every day, and I think it's a great time to be like a dentist. Like I was saying, we have so much information that we can consume. Whether you're getting information from CE courses or from mentors, like in an AGD program, or even if you just go home and you do stuff on CDocs or whatever it is, or if you're just scrolling through Facebook and want to look at dental clinical pearls or something like that, or through Instagram or whatever it is, we have so much information that we're able to consume at this time. And I like think back, like if I was alive in like the prehistoric days, I don't even know how I would survive, because I just need to like consume this information and try to get better. But yeah, it's been great. And like one other thing that's really great is that I feel like my interests kind of change so often, and it's really allowed me to kind of delve deeper into different aspects of dentistry and get to know as much as I can and learn as much as I can while I have this opportunity.
That's awesome. And I feel like everything you're describing is like why general dentistry is so great, because you can just do it all. And then if there comes a point where you just love one specific thing, you can just do that. But
for sure,
you have so much opportunity to learn and grow, and there's so many different things we can do. And your cases that you made on your new Instagram, I love seeing them. They're all beautiful, which is cool.
Yeah, I'm trying to get better at photography. That's one thing that they really try to preach during this program, is to try to take pictures of everything. One for yourself. It's nice for me to go back at those pictures, and then I'm able to say like, oh, I really didn't see this, but you can be kind of hypercritical of yourself, and I think that's how you grow and get better and stuff. But one other thing that I will say is really nice about Army dentistry is that I've mentioned like a lot of stuff that talking about like implants and these surgeries and stuff like that, which are expensive in the outside world, but in the Army it's all covered, obviously. So you're able to treatment plan and kind of make the best personalized treatments for each patient, based solely off of like what's the gold standard. And I'm not trying to like sell dentistry or anything, which has been great. So for a learning program like this, it's been so nice to be able to kind of not have that in the back of my mind, not thinking about insurances or not worrying about patient finances and stuff like that, and just being able to give them the best possible treatment. So.
Yeah, absolutely. There's so much that comes into play when you're outside world working in a private clinic or a corporate clinic, and your student loan payments in the back of your head, and there might be someone telling you what to do. And yeah, there's a lot when it comes to finances on the outside world. So that's definitely a nice element that you don't have to worry about that. And you can know you're as ethical as possible, which hopefully everyone is, but
right.
I mean, you just never know.
Right.
So you were saying in a couple months you're moving. So what's next?
Yes. So my wife and I, Hannah, will be moving up to Fort Campbell, which is on the Kentucky-Tennessee border. Very, very excited to get up there. It's about 45 minutes northwest of Nashville. Been to Nashville once for a hockey tournament in college, or a hockey game in college when we played against Vanderbilt, but haven't really been able to explore the city. So it'll be new for the both of us. Neither of us are country music fans, but we're willing to try anything, I guess you could say. But yeah, I'll be working at Fort Campbell for the next couple of years. And super excited to get up there. It's nice because it's, driving distance away from Michigan. I think it's like an 8-hour drive back to Grand Rapids area, which is where my wife's family lives, and I have family in that area as well. It's just a little closer to the Great North, but excited to get there. I'll be practicing as a general dentist and getting what I'm hoping to get, which is my ACP, which is Advanced Clinical Practice Certification. And so the Army does a super cool thing where after you do your 1-year program, if you do a certain amount of procedures after that, you can get ACP certified, and that gives you a little extra bonus on your salary, which is cool. And so I think it's like you do X amount of implants, you do X amount of perio surgeries, you do X amount of third molar extractions, X amount of root canals, and you can eventually get that. So that's my next goal. I'm always trying to work towards something, but that's my next goal. And when I get there, is to really try to hunker down and get with people that specialize in perio and endo and stuff like that, and use them as resources to continue to learn. But no, definitely very excited to get there and to experience a new place. But it is a little sad to leave South Carolina. It's awesome down here. The weather's great. We're an hour and a half from Charleston and the coast and all that kind of stuff. So we've been able to enjoy that kind of stuff a lot. But yeah, we're excited to call Tennessee home for the next couple of years.
That's awesome. So is this contract with that location? I know you said with the Army, people get moved around a lot. Is that did you sign for a certain amount of years, or how did that work?
Yeah. So the way it works is that with my HPSP scholarship, I did the 4-year scholarship. So they have, I think, 4-year, 3-year. Sometimes I think they may offer a 2-year, depending on what's going on, if they need people or not, whatever. But I did the 4-year scholarship. This AEGD program does not count for or against. So this is a neutral year. It's just a neutral year for us to learn. It doesn't count towards my service obligation. So after this year, I'll be starting my 4-year payback. And so I think this Fort Campbell spot will be for at least 3 years. So we'll be there for at least 3 years. And if I just do my 4 years and want to get out and go into private practice, then they'll probably keep me for those full 4 years. If I get, through these 3 years and I decide I want to stay in, or I want to go to another residency program or whatever it may be, then, things may change. But, if I were to ride the rest of this contract out, then it would be most likely that I would be at this next spot for the rest of the time.
Nice. And I feel like everything that you've shared today really is such a cool contrast to what I talk about all the time here, which is my own experience at my private office I'm working in right out of school. So it's a great chance for people to see other options that are out there and other ways to grow and learn in a totally flip side, different realm. But before we wrap up, do you have any final advice for anyone listening that's perhaps a dental student or maybe even pre-dental still?
Yeah. I think the best advice that I have gotten and that I can continue to give is, try to find things in your life that you enjoy doing outside of dentistry as well. Don't don't lose sight of your hobbies. Don't lose sight of the people that are important to you, because that's kind of what's going to propel you in whatever journey you're kind of taking. I'd also say, like, I'm a very positive person. Try to stay as positive as you can. I know that's easier said than done sometimes, but do things that get your head in a good space. Do things that make you happy. For me, that was playing hockey and playing golf. And I still do that to this day. And I think it's just so good to have other outlets, because if you just sit there and you get stuck in your head and you get consumed by it over time, and it can really drag you down after a while. I would say just, try to make a plan, and your plan might be different than anybody else's plan, but it's your plan and nobody else owns that plan but you. So own it and kind of be patient and stick to whatever your goals are. So.
Awesome. Well, thank you so much for your time. I really appreciate it. And if people want to reach out to you, maybe you can just give me, like, either if you want them to message that Instagram or your email or something, I can put it in the description of the episode.
Yep. I'd be glad to help in any way, shape I can. I'm always here for any questions, whether it's dentistry or Army or anything like that, or dental school, or how I kind of navigated my path into dental school and stuff. So definitely would be happy to be a resource, and I definitely appreciate you having me on here today.
Thank you.